I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm chair of the committee, and I'm joined today by council members Bender, Andrew Johnson, Elizabeth Glidden, and Alondra Connell. I think we'll be expecting Council Member Fry here soon. That's not actually Council Member Fry. It's Council Member Heidi. We have 3 discussion items and 4 consent items today. I'll go through the 4 consent items and then move those. If any committee member wishes to pull something from consent, we can take that off and we can discuss it further. And I'll note that we now are joined by Councilmember Fry. The first item is confirming appointments to the Minneapolis Food Council. There are 7 mayoral appointments for 2-year terms, and there are 8 city council appointments for 2-year terms. I will read off the names of the mayoral appointments first. Beth Dooley, Paku Hang, Russ Henry, Devon Noland, Carolyn Devani, Allison Meyer, and Ruel Islam. And the council appointees are Zoe Holloman, Julia Basenda, Sada Andalalam, Lacora Bradford, Martin Brown, Journey Gosselin, Magdalena Galusa, and Latasha Powell. We also want to thank outgoing members, Sammy Ardito Rivera, Allison Babb, Omari Chapman, who also served as co-chair, Chris Igo, Jesus Perez, Aaron Reeser, Hashap Sika, and Reese Williams for their service on the Food Council. The second item is approving appointments to the Minneapolis Community Environmental Advisory Commission. There's 2. One is Jana Grave, representing Clean Water Action, City Council appointment representing an environmental advocacy group, and Ricardo McCurley, a mayoral appointment representing residents. We also want to thank outgoing members, Shalini Gupta, of the Center of Earth, Energy, and Democracy, and Martha Ockenfels Martinez for their service. And I think Shalini's actually here, so thank you so much. The third item is approving an appointment of Deborah Jakawe from Ward 8 to the Minneapolis Advisory Committee on Aging. The fourth item is authorizing agreements with our clinics to implement process and care improvements for hypertension and prediabetes management for priority adult populations in Minneapolis. And the 3 clinics are the Neighborhood Health Source, Hennepin County North Point Health and Wellness Center, and the University of Minnesota Community University Healthcare Center. And they will each be getting a contract for $100,000. And that concludes the consent items. So I will move all 4 of those items forward. All those in favor, please say aye. Aye. Any opposed, say no. Any abstentions? Those actions are approved. And now we'll move into our discussion items. We have 3 discussion items. One item that's not on the agenda that I'm bringing forward is our Minneapolis Green Zone Policy Work Plan and Task Force. So that will be number 7 on the agenda, and we'll have a discussion on that too. But first, we're going to hear from our statewide health improvement program staff. I'm going to ask Ms. Patty Bowler to come up and start that presentation to hear about the work that they've been doing with their for the past year, maybe 3 years.
Yes.
Afternoon.
Good afternoon, Council Member or Council Chair Gordon and members of the committee. We just were all at a celebration for the healthy living work that has happened over the last couple of years. And there were words said not by city staff, but by our community partners like, we have renewed optimism. There are thousands of residents that are being positively impacted by this work. It's community driven. We didn't know that the city was doing this work. I'm so proud of everyone here. Those were 5 different comments by 5 of our partners. We had over 70 partners who were represented and others that weren't there. So it was just a wonderful celebration. So I wanted to just thank everyone. Not a lot of folks were able to come over here, but if you were part of the healthy living work, please stand up. Okay. Just wanted to acknowledge your partnership. And also, staff oftentimes don't get thanked. So we've got a Dynamo staff led by Laura Pratt, and you're going to hear from Laura in just a minute. And with her, although they're not here because I'm sure they're cleaning up the room, Sarah Rubin, Deanna Pennington, Sarah Stewart, Nora Gordon, and Vish Vashani, and two staff that weren't here today but deserve a lot of credit, Kristen Klingler and also Martina Campbell. So they all deserve our thanks and praise for their good work. And now I'd like to introduce Laura Pratt, who is the Healthy Living Manager for all of this work.
Good afternoon.
Afternoon, welcome.
Thank you. So I came to you 2 years ago to share our Healthy Living Initiative and describe to you what we were going to do between 2014 and 15 with funding from the statewide health improvement program. So today I'm back to tell you what we've accomplished. We have been working under our third round of SHIP-free funding, which just ended in October. So it's a good time to sort of reflect on what we've accomplished and get ready to move forward. So to remind you, the Healthy Living team works with community partners to create opportunities for everyone to eat healthy, be active, and live tobacco-free. And we run some initiatives ourselves, but mostly we work in partnership with community agencies, a few of which are here with us today. So each of the dozens of SHIP-funded projects deserves its own presentation, but I only have about 10 minutes. So I'm going to focus on the ones that you may be less familiar with. But as I do, please note the thank yous that are listed on each slide so that you can see how many agencies and sites have been involved and are positively affected with this funding. So our approach in active living is to support communities and schools in creating safe, accessible places for people to be active. And our dedicated partners at Minneapolis Public Schools continue to expand their Safe Routes program. On a weekly basis, about 3,000 MPS students get off their buses about 3/4 of a mile from school and walked together, arriving at school refreshed and ready to learn. MPS has also expanded its bike fleet program, which brings biking opportunities to schools across the city. Hope Communities in South Minneapolis convened a network of partners and residents to create a vision for a healthy Franklin Avenue. So far, this network has weighed in on the 35W Bridge redo, started a mini farmers market, and secured more funding to include resident voices in the reorganization and redesign of Franklin Avenue and the surrounding community. Similarly, Waite House in the Phillips neighborhood engaged its Latino residents to identify the safety and access issues that affect their ability to be active in the neighborhood. And over the summer, they convened a forum, which Councilmember Cano attended, and other policymakers to share their concerns. The Health Department has also expanded its relationship with Minneapolis Public Housing and the Minneapolis High-Rise Representatives Council, which serves the thousands of residents who live in the high-rise buildings. And because of our work together, residents at 10 buildings identified safety concerns and shared them with Public Works and Metro Transit. And already a stop sign has been added at a dangerous intersection. A resident has joined the Pedestrian Advisory Committee, and residents in many buildings will participate in Public Works snow maintenance study this winter, if we have snow. They were supposed to participate last winter, but there really wasn't enough snow. Each of these projects, the common thread between them is that these improvements are community identified and community driven. Going forward, we want to continue to support these community driven ideas and increase opportunities for people to be physically active. And we're going to be launching a project in the Cedar Riverside area to increase opportunities for physical activity, especially for Muslim women. In the area of access to healthy foods, you are already quite aware of the Staple Foods Ordinance because you were involved with it, but you may not be as familiar with some related aspects of it. 10 stores participated in our corner store program and underwent some substantial makeovers to make their produce more visible and attractive. And the health department's Nora Gordon, along with St. Thomas University and the Community Tables Cooperative, developed a traveling produce procurement system called Brightside Produce Distributors, which delivers produce to corner stores throughout the city. So the young people in that photo are North Minneapolis residents who are employed by this program. And the health department staff and the University of Minnesota are conducting an evaluation of the Staple Foods Ordinance to share the results and its impact with cities across the country. We recently presented the Rethink Your Drink campaign, so I know you've heard about our efforts to encourage people and places to choose healthier beverages. But as a reminder, through the efforts of groups like HAMA and other community-specific groups, the Rethink message had a presence at over 85 community events over the summer and has resulted in healthier practices in scores of institutions such as schools and work sites. As a result of our work with emergency food programs, 10 food shelves and 3 meal programs are consistently offering healthier food to their clients, especially produce. And in terms of community gardens, Gardening Matters recruited an additional 238 low-income residents from different cultures and languages and connected them to the local foods resource network, where they receive training, tools, and education to help them grow their own food. And the health department and residents of 7 public housing high-rise buildings, including these fabulous people over here who just walked in, started community gardens at 7 buildings. Also, with the assistance of Gardening Matters and the health department, Solid Waste and Recycling revamped its system for distributing the city's compost. Before, it operated on a first-come, first-served basis. So the people who were in the know how to get it and got it, and others were left out. But now the program is widely promoted in low-income communities, and it operates under a lottery system, which gives all people access and an equal chance of receiving this great city resource. And I really like this project because I think it's a great example of our Healthy Living team contributing to the One Minneapolis goal. The Minneapolis Park and Recreation Board is rolling out 100% healthy vending in its recreation centers, and it's poised to renegotiate its Coke contract in 2016. As a result of our Healthy Restaurant program, 8 independently owned ethnic restaurants modified some of their most popular entrees to meet nutrition standards. And you can see on the slide the impact on calories, sodium, and fat that this project had. So Los Ocampos, for example, on East Lake Street, added 4 healthy dishes to their menus and widely promotes them under a Better Bites label. In 2016, we'll bring the implementation date of the the Staple Foods Ordinance and an expansion of the Rethink Your Drink campaign, and then ongoing work and support with the emergency food programs. Our strategies in tobacco-free living have been to reduce exposure to secondhand smoke, help people quit, and prevent young people from ever starting. And through your actions, Minneapolis passed the Tobacco Price and Flavor Ordinance in July, and this is greatly going to reduce the availability of cheap flavored tobacco products. This goes into effect on January 1st. The Association for Non-Smokers worked with landlords across the city, resulting in 95 new smoke-free building policies and 2,800 units worth of people who are no longer exposed to secondhand smoke in their homes. And going forward, the health department intends to conduct a citywide survey of rental property so that we can identify buildings that could still use some help providing a safe place for their residents to live. To help people quit smoking, the Native American Community Clinic and Volunteers of America, which operates in the public housing high-rise buildings, have assisted hundreds of people with smoking cessation support and counseling. To address childhood obesity, our consultant, Renee Wixon, worked with 4 safety net clinics, which trained all of their staff on respectful, motivating approaches to talk to families about weight issues. And they integrated individualized weight management counseling into their programs and services. And Children's Hospital and clinics took their program a step further by enhancing their Vita Sana program, which is a family-based, community-based nutrition and exercise program in the parks. And so the clinic and the hospital, the clinic and the community program have a direct pipeline so that families can be served. Megan Ellingson, another consultant, has worked closely with the Minnesota Academy of Pediatrics and the Minnesota Council of Health Plans to clarify current health plan reimbursement for these types of services that the clinics are now offering, and eventually to expand reimbursement options to community-based services. There's got to be a way to pay for these programs because they really do make a difference if they're delivered effectively. In 2016, these efforts will continue, and with additional funding, the health department will support clinic efforts to prevent diabetes and help patients manage high blood pressure. The health department also supported activities in childcare and work sites. Thanks to Think Small, 175 toddlers and preschool children in 24 childcare programs eat better and move more because of training and individual coaching. These childcare programs completely eliminated sugary drinks. They increased the amount of outdoor play they gave to children, even in the winter, and they serve more vegetables more often. And we're really proud of this work because these are small, family-based, home-based childcare programs, many of whom are led by non-English speaking residents who don't have a lot of access to this information. 10 small work sites that aren't either big enough or rich enough for their own wellness programs developed healthier practices as a result of the SHIP work. For example, Graco adopted a healthier vending, and many work sites increased their breastfeeding-friendly practices for their working moms. I would say one of our greatest accomplishments over the last 2 years has been our intentional and successful engagement of Minneapolis youth. Anticipating both their energy and their potential for creating a healthier Minneapolis, Deanna Pennington developed 3 models for working with youth. As you know, the Minneapolis Youth Congress demonstrated great leadership in the 2 tobacco ordinances that were passed in the last year. Also, Native American and Latino youth who are part of the YWCA Strong Fast Fit program went through a year-long program to learn about public health and build their leadership skills. And so they've presented changes that they'd like to see to the YWCA's programming. And we're excited because the YWCA has piloted this program and they continue to offer it. And then they've also developed a curriculum that will help us share their model with youth serving organizations throughout the city. Migazi Communications and Neighborhood Hub and 8 other youth organizations participated in the Summer Rethink Your Drink campaign, which put youth in the driver's seat of outreach activities and policy changes. The youth tabled at open streets events throughout the city, and Migazi eliminated its soda fundraising, and the Neighborhood Hub created a youth center at Lowry Open Streets. The cookie cart in North Minneapolis stopped selling sugary drinks and now sells an unsweetened iced tea instead. And all of this youth work has demonstrated the power that youth have in driving change and raising awareness and bringing their own creative ideas to community health issues. So the accomplishments that I just raced through are unique. They do share some commonalities. First, as you know, they were funded by the statewide health improvement program. And second, they exemplify the authentic partnerships with many kinds of Minneapolis entities: stores, schools, restaurants, clinics, community agencies, the parks, and more. And the Healthy Living team thinks that it's really doing its best work when we offer our unique role and perspective, funding, and expertise so that communities can act on their own healthy living priorities. And going forward, we intend to continue doing this, expanding our youth work, continuing our community-driven work, and fostering and supporting community solutions so that all Minneapolis residents have the opportunity to be healthy. I hope you will join me in thanking the staff, none of them are here, and partners who made these great improvements to Minneapolis. Thank you.
Thank you very much. And just to let my colleagues know that I did go and participate in the luncheon that preceded this. And on your behalf, I extended the gratitude from the entire City Council and took the liberty to do that because I know that the Council all really supports a lot of these things. In fact, I talked a little bit about how some of them, like healthy walking, not smoking, better access to healthy foods, are the things that we also recognize our constituents really value as well. So I appreciate that and all the work and all the partners. And it's great to hear that we're going to keep going. We're going to have this healthy living team working and moving onward. There's a lot going on, and I think you really have shown that by involving the community and other groups out there, you can really make a big difference, and that our community partners have been key. I know there's other committee members who want to make comments. Councilmember Bender.
Thank you, Mr. Chair. I just wanted to say thank you and voice how important I think the statewide health improvement program has been in fostering health in our community. I've always appreciated how much these are really big issues. They're big, expensive issues that if we don't take action now, we will be paying the consequences for many years in the future. And I think sometimes these programs feel like small drops in the bucket of change that we have to make, but I've always appreciated how intentional both our city and state health departments are, that the partnership that we have with the state, I think, is really important, and how committed our staff is to really using evidence-based solutions, to really making the case for how these programs, when we're working with, a handful of restaurants or daycare providers, are really making the change over the long run that we all need to work together to make in the future. So I just wanted to say thanks.
Councilmember Glidden.
Thanks, Mr. Chair. And I just want to say thank you, too, for the presentation. I know that we are always very competitive in applying for these funding streams from the state, and I think that kind of just shows their confidence in the city of Minneapolis having good, well thought through initiatives, a good process, and all the other elements that go towards them feeling that they are investing well in the kind of outcomes that they're hoping to see. So I just wanted to say again, congratulations on doing a very nice summary of really, I agree with Councilmember Bender, big thought processes and how to make those connected to community and community driven. I think really takes some thought and talent and willingness to work well with community partners, and you've certainly shown that. So thank you.
Thank you very much. I don't see any other comments then. And I know that we're joined by a few other community partners. So folks got to stand up earlier. And so welcome. And I'm glad that you were here and able to participate in everything today. So then I will move to receive and file the presentation. All those in favor say aye. Aye. Any opposed? That motion carries then. And that brings us to our next item. And Mr. Robert Thompson will come forward and tell us about the Neighborhood Revitalization Program, and particularly for the policy for expenditure of funds. And this is following up on a staff direction that we put out some time ago. Welcome.
Thank you, Chair Gordon, council members. What I'm talking about today is the policy for the expenditure of NRP funds. And what we are asking you for today is two items. First is for your approval of this policy for the expenditure of NRP funds, and also to, as you can see, quite a mouthful here, but to direct NCR and finance staff that any neighborhood for which a Phase 2 funded contract is amended to remove funds or closed out with the balance remaining in that contract, that neighborhood shall be allowed to contract the amount released back to their Phase 2 plan as a result of the amendment or close out of the contract. And I'll hopefully give you a brief explanation of that later. If you approve this policy today, here's what's going to happen. First, NCR will prepare a status report of each neighborhood's Phase 1 and Phase 2 NRP plans, and we'll do this basically in chronological order of their Phase 2 plans approval. And what we'll look at as we're doing this is, first, was the Phase 2 plan approved more than 7 years ago? If so, are at least 85% of those neighborhoods' NRP funds expended, and are at least 95% of the neighborhood's NRP funds contracted? So those are going to be the thresholds that we'll be evaluating neighborhoods on. If a neighborhood organization has not reached either of these thresholds within that 7-year time frame, one of three options there. Either they will have to submit a plan on how they will achieve the thresholds within 1 year. So some neighborhoods are much closer to that outcome than others. Or they must complete a robust neighborhood review process to affirm or revise existing strategies. And then 3, to request a waiver. Once we've done that, if the neighborhood has to do a review process, then all of these reviews will be submitted to NCR for review and approval. So we need to look at how they're doing that. The NCR director may submit that review, any reviews that reallocate more than $100,000 to the NRP policy board. And any new action plan strategies must be submitted to the NRP policy board and city council for approval. And this is basically following the NRP law. The policy also will require that neighborhoods that have not yet submitted an NRP Phase 2 plan for approval must complete a Phase 2 planning, their Phase 2 planning by December 31st, 2016. So we really have 2 neighborhoods with remaining Phase 2 plans at this point. So we want to have them on a deadline there. And actually both those neighborhood organizations right now. And we also have University Neighborhood, which doesn't have a neighborhood organization. But these other 2 are working on plans right now. A neighborhood that fails to submit a completed review or Phase 2 plan as required may have some or all of its unexpended NRP funds reallocated to other neighborhoods by action of the NRP Policy Board and City Council. Now, this is that long part that I'm asking you to review is regarding footnote P, which was part of the 2010 budget action by the City Council, so it goes back a ways. But basically, it was kind of a small footnote, but it had kind of, for us, some implications in terms that it really prevented us from closing contracts and taking money out of those contracts that neighborhoods could reallocate them to projects that they wanted to do. So it was amended a couple of times, then actually kind of fell off the books. But because the last time we had any direction from City Council on this, basically limited our ability to remove money from some contracts. We just wanted to have clear direction from the City Council on that. And just some real quick analysis, and I've run through some of this before, but basically some of the reasons for our recommendations on this policy is that we started out actually this whole process with looking at how neighborhoods were expending their funds. And what we found is that actually in aggregate, neighborhoods were spending their NRP dollars down within 7 years of plan approval. So they're actually doing it within a quicker time frame than the original 10-year time frame that was established. And in fact, during the 2000s, during the early part of Phase 2 of NRP, both the NRP Policy Board and the city enacted policies to actually slow the rate of Phase 2 plan approval and expenditures. And the reason for this was that there were projections at the time that showed there would be significant drops in the revenues that capitalized the NRP program. And this graph here, this chart actually shows not just projections, but the reality that, as you can see, and the NRP program was funded about $20 million a year for the first 10 years, and then that dropped off significantly during Phase 2 until the last, basically, year of NRP. And this is important because, as I presented last year, we have neighborhoods organizations generated about $25 million of program income. So their use of the NRP dollars, they were actually generating additional revenue. And that was actually a pretty good chunk of the fund balance, the NRP fund balance that was available. But given those revenue projections that neighborhoods saw in the policies, neighborhoods, rather than using their Phase 2 funds, since they weren't available, what they actually did was reallocate a lot of their program income that they had generated into implementing their Phase 2 plans. And so if not for these Phase 2 shortfalls, a much higher percentage of that NRP fund balance would actually be program income. So again, what we're asking for here is first to approve the policy for the expenditure of NRP funds, and also to allow us again to be able to close those contracts essentially where we have dollars locked up that were held up by this previous footnote, and move forward with that. So any questions about that?
I had one small question. It had to do with the waiver, and maybe you mentioned this and I missed it, but is the waiver, does a waiver have to be approved by the NRP Policy Board?
That would be done internally by the the NCR office, actually.
Okay. And when would does the policy articulate when a waiver might be granted? I think
it just talked about the conditions under which a waiver could be granted. When we were talking with neighborhoods about this policy, they raised a lot of concerns about there are a lot of things outside of their control. that might impact their use of the dollar funds. Oftentimes they're waiting for, say, a city department to actually move forward. So a number of neighborhood organizations mentioned, say, a public works street project, that they might be waiting for implementation there. They have no control over that. So that would be one. Others mentioned, hey, we've had program income come in recently, or we've recently done a plan modification or a change to our plan that's kind of moving this direction. And actually, that's part of it, is we do see a number of neighborhoods actually right now already going through this process of realigning their NRP dollars. So we wanted to account for that in the waivers process. And there is a section here that identifies how those waivers work, what's eligible, basically.
Okay, thank you. Councilmember Johnson.
Thank you, Mr. Chair. I was curious if you could explain the process that got us to this point. I know NCEC had a role in drafting these recommendations, and also what level of input was sought from the neighborhood associations around this, and what their general feedback has been on these recommendations.
Oh, yeah, absolutely. We actually did several things. Following the recommendation from this committee, which was, first of all, we did look into the background, did some research to identify what the scope of the problem was, and then we actually started out with a survey to neighborhood organization leaders to get some initial feedback on what we were thinking. Then we drafted up the policy. We had some discussions both with the neighborhood, actually went to the Neighborhood and Community Engagement Commission, I think it was like 3 times at least, and also met on a few occasions with the NRP Policy Board, because they ultimately have some role in the policy as well. And we did a 45-day review and comment period with neighborhood organizations. And during that, we held a couple of meetings, informational meetings, where they could come and talk to us so we could explain what we're looking at. And we actually had a lot of really good feedback on it. We had comments, for example, on, the 7-year time frame, right? Is it too long, too few? And actually, I was really surprised. A lot of neighborhoods really like the 7-year timeline, but some said should be more, some should be shorter.